All right.
Okay, so that's
You're good to go.
everybody get right?
Yep. You're good to go.
Okay, wonderful. Well, thank you so much for having us here today. We've already had our introductions, but I think most of you are familiar with Kelly and the work she does. Kelly, I don't know if we need to say a formal introduction at this point.
I feel like we've done our introductions, but our office works closely with Helen's organization. So while she's not part of our office, I feel like we work together most days of the week.
Yes. So thank you again for having us. We're going to talk a little bit about dental access and workforce, specifically in Pennsylvania today, but a lot of this information sort of applies across the board. So we hope that you'll be able to get some nuggets from the information that we share. We're going to touch on a number of items. As you can see here, when we talk about dental access and oral health access, of course, you also have to discuss workforce. When we're talking oral health care services, we know that we have a supply, and that's the workforce, and then a demand, which is the access. So it's a supply and demand relationship. And it's an interesting model for healthcare. So today we're going to talk a little bit about some of the insight of what we've learned around some of the projects we're doing in Pennsylvania to address both sides of this dilemma. And we're also going to review what we call our bright spots, which will be areas that we see potential already developing in our state, and then all of the future possibilities that could be some long-term, long-range solutions for addressing that. So I'm going to start by giving you just a few minutes of background on our State Oral Health Coalition. I'm not sure how many of you are familiar with State Oral Health Coalitions, but most states have them. So hopefully you're already working hand in hand with yours. But it gives a little bit of information of how we've sort of evolved into this work. The Pennsylvania Coalition for Oral Health, which we call PCOH, was informally started back in 2011. We had some local dental association dentists that wanted to start working together and started partnering with public health minded community members to form this coalition of sorts. And they really recognized that we had a problem in our state. So the coalition was brought together originally around the subject of community water fluoridation, but we quickly developed our focus into more broad oral health areas. So back in 2012, 2013, members from PCOH joined forces with some other state level groups, as you can see listed on the slide here, to really focus on children's oral health initiatives. We formed a collective at that time, and that group still actually meets monthly. So it's been, 8 years of a lot of meetings and some great partnerships and friendships. We share a ton of things. We share funding opportunities. We share program objectives. We share a lot of success and some disappointment too. And I just wanted to sort of offer this background to tell you a little bit about how a state oral health coalition and a state office of rural health could actually work together to accomplish some health objectives and improve health outcomes too. So through this partnership, we've seen an increase in oral